national levels. And I'll mention a few of them. Dr. Kovats is the knowledge mobilization lead for the National Institute of Health Research, which is a UK government agency's funded health protection research unit in environmental change and health. This is a research program on climate change impacts, public health adaptation, and the health benefits of low carbon development in partnership with the UK Health Security Agency. Dr. Kovats is also the co-lead for the Belmont Forum funded Climate, Health, and Maternal and Neonatal Health Research Consortium. She was co-lead for the chapter on health of the evidence report for the UK's third climate change risk assessment in 2021, and coordinating lead author for the multidisciplinary regional chapter on Europe in the fifth assessment for the Intergovernmental Panel on Climate Change, which is an agency created by the United Nations Environmental Program and the World Meteorological Organization. She's also co-authored a number of key scientific assessments on climate change and health at both the UK national level and regional levels. She's provided expert advice on climate change, climate variability, global environmental change and health to the WHO, the WMO, and the World Bank. It's really very kind of you to take this hour at the very end of your Friday to speak with us. I'm looking forward to it. Thank you.
Thanks very much for that introduction. Okay, so I'll just go ahead and show my slides. Let's go to the top. So yeah, thank you for the introduction. So what I'm going to talk today is about getting evidence into adaptation policy. So I'm just focusing around adaptation, which is the response. So it's reducing the health impacts of climate change. And I'm not going to discuss mitigation or the health co-benefits of kind of reducing carbon emissions at all, except where, of course, it does interact with adaptation, because those are both policy priorities, and adaptation has to be done in the context of net zero priorities and other priorities as well. And we're in a post-COVID world as well, and that will affect our capacity to respond in the public health system. So I'm going to be talking particularly around the UK, and particularly around the UK climate change risk assessment. But as the introduction said, I'm also knowledge mobilization need for this. It's a research collaboration, a 5-year funded project called the Health Protection Research Unit in Environmental Change and Health. So it's a bit of a mouthful, but what's key about this, it's funded by the Department of Health, but we work with the UK Public Health Department, which is now called the UK Health Security Agency, but it was Public Health England. So they're part of the consortium, and we're also working with them to ensure that what research is done is what research is relevant for public health action, essentially. So it's not as easy as it looks, as I'm sure you all know. If you work in this area, it's very difficult to gain evidence into policy in whatever field you're in. So there's a big shift, of course, to have co-design and set up grants and so on, so that you're talking to the decision makers and the stakeholders at the very beginning and at the planning stage, and even at the grant writing stage, to make the research usable and useful and usable. So I'm going to give an idea of some of the research, some of the papers I'm showing, or all the research that we've done within the HPRU as well. So I'm going to be talking about the risk assessment and the methods, because the UK is actually fairly advanced, and I think that what they've done in this last round of the risk assessment is really very useful and very robust as well. And different countries are at different stages of their national risk assessments. The US obviously has a national risk assessment, and I think you're gearing up to starting on the next one, as I understand it. But we've just finished ours, and then I'm going to talk a bit more about the specific research evidence around looking at the impacts on health from heat, high temperatures, and the impacts from flooding, and then the adaptation assessment, which of course is now part of the risk assessment. They're not kind of decoupled as they used to be in the past. And what we really want is evidence for adaptation, evidence for policy. And the other important part of a risk assessment is adaptation prioritization, because what used to happen is that you'd come up, you do a very intense risk assessment process, do a lot of modeling and come up with a lot of really important science and a lot of results, but then it was like, so what? You know, then there'd just be a shopping list of adaptation options and the policymakers wouldn't know what to do. So there's a specific role within this risk assessment in prioritization. So we have the Climate Change Act in the UK, and we're on actually the third cycle of this science policy process. And you can see here the red, so the blue is the science bit, so the blue is the evidence report. So we've just submitted to Parliament the third UK climate change risk assessment. Sorry, there's so many acronyms. So the third CCRA, as we call it. And then at the and that's now being considered by government departments, and they are writing the third national adaptation programme, which is for national government and public agencies. So there's not a statutory requirement to adapt, but there's a requirement for all public agencies in the UK to consider adaptation. And the other really important part of the Climate Change Act that we have is we've got this Committee on Climate Change. So they're an arm's length body, and they are mandated to review adaptation progress. So they're responsible to checking that where public bodies have said they're adapting, that they are adapting, and they do regular progress reports as well. And they obviously looking at progress towards emissions reductions as well. So they're covering adaptation and mitigation. But having that independent body to review progress is of course extremely important. So this shows the methods for the climate change risk assessment process. So if you look at, so they have the exam question on the left, and on the right we have the 3 steps. So the first step is obviously the quantification of risks, some scenario impact modelling, spatial modelling, population-based modelling, considering past extreme events as well, how we've dealt with those. So the second step is the key one. It's looking back to see how well we're dealing with. So it's not just how we've dealt with past extreme events, but what policies and measures are in place to address them. So, you know, what policies in the built environment, in planning, in building design are in place, you know, what public health strategies are there. So we have the heatwave plan for England, so clearly we'll be looking at that. And then we do an assessment on that, which is all kind of clear and transparent and supported by the evidence. And then we of course consider the co-benefits of adaptation, because you have to make show that adaptation is cost effective, and of course most public health measures are highly cost effective, but we consider co-benefits in other sectors. So green space is a prime example here, nature-based solutions. There's clearly a lot of interest in that at the moment. And then you can see clearly there's 4 options for scoring each risk at the moment. More action needed is the highest, the most urgent, and then further investigation, and then a watching brief. So how do you make your risk assessment useful? You obviously have to talk to the people who are going to use it. So along with all the research and the evidence reviews and going through the literature and also looking at policy documents, so there's a huge amount of work involved in this. There's iterative stakeholder engagement. So at the very beginning, there was a lot of meetings with stakeholders and how to encapsulate the risks. There are a lot of risks, there's about 60 risks in the whole report, and how we sort of narrow those down and how they're kind of collected together is quite an important process. So they have to be, you know, fairly comprehensive, but also not too broad that they're not meaningful, but not too narrow, so you end up with 200 risks instead of 60. The other clear thing about adaptation to focus your assessment is you have it's located in space and time. So you're clearly targeting national decision makers, not local. And then you're looking at these policy decisions between 2023 and 2028. So that's not just for impacts in that period, it's obviously decisions that need to be made that have implications for the future, because there's a lot of decisions that have a long lead time or lock-in. So anything about planning or buildings or designing buildings that will be in existence in future decades where it's much hotter, you clearly need to make those decisions now. So that was a key focus of the assessment. And then we also did it under 2 scenarios of climate change. So 2 degrees by the end of the century, and then a much higher rate of warming, which was unfortunately what we're on target for, which is 4 degrees above pre-industrial by the end of the century. So clearly, as I've said, prioritizing adaptation options is very important. So we start off with what we're all familiar with, which is how effective are particular strategies or policies, how cost effective they are. And there's, varying evidence around cost effectiveness, of course, and also how fair they are, although that's not given as much importance as it should have, but who benefits from these adaptation options or who's potentially disadvantaged. But it clearly, as I've said, this issue of time is very important. So you focus on things that have no regrets or low regrets options, these win-win sort of options with clear co-benefits, but also take into account long lead time. So for all the risks and all the policies, you need to think about when the decisions have to be made. And in the literature now, there's a lot of focus around adaptation pathways, which is essentially about when you make decisions and having decision points. And that works quite well for some risks, particularly around infrastructure, but may not work well for other risks that we have to deal with in public health. So here's a brief overview of all 61 risks. I know you can't read that, and this is across the whole chapter. So N is the natural environment, if you can see, and I is chapter 4, that's infrastructure. So that's around critical infrastructure, transport, IT, that sort of thing, water resources. B is for business, and there's more opportunities in business than there may be in other chapters. And H is health and the built environment. So we're looking at communities as well, not just health. And I, the last one, is for international dimension. So issues around food security and migration and those sorts of things that are about impacts of climate change external to the UK. And here's the risks in more detail you can see that we had in our chapter. So there's 13 risks overall. And you can see how we've tried to break it down into sort of manageable chunks. You can also see what the most urgent risks for the UK are and across the regions. I mean, not the regions, the other countries. So clearly impacts to health from high temperatures and heat waves is urgent risk. And remember, it's not just urgent because of the magnitude of the risk, it's urgent because there's not enough action being taken to address this risk. We're at risk from flooding. UK is particularly prone to flooding. Only some areas are vulnerable to sea level rise or loss of communities, or communities having to move. There's the reason opportunities from energy demand is because the reduction in winter costs to fuel is seen as quite large at the population level. We have risks from vector-borne diseases, and we have risks to health and social care delivery, which is actually very important sort of policy wise, and risks to schools. So this is, again, there's some duplication here because the risks to health and social care delivery and the risks to schools are clearly driven by heat waves and flooding, but we looked at a more kind of organizational or systemic, a systems-based approach to how they're managing the risk. So just a reminder that public health is framed about community level impacts, and we look at local kind of place-based approaches, and public health is very much focused around individual level vulnerabilities and sort of population level vulnerabilities. And we have to consider how climate change will interact with these other sort of the social determinants of health, both within the built, how important. So what I'm saying is it's important to consider how climate change will impact on the built environment. So a lot of our risks, in fact, for heat and flooding are being mediated through the built environment, which goes back to how important planning and building design are for public health. And also how we are taking generally a health and all policies approach, which is a framework from WHO. So it's very much about communicating health risk in other sectors. So nearly all these risks are managed outside the health sector. And there are kind of well-known barriers in how to get health considerations in other sectors. But a lot of adaptation is also kind of very familiar to people who work in public health. So it's looking at population-based interventions, it's looking at evidence-based interventions, it's looking at cost effectiveness, and it's looking at how those, who benefits from those interventions within the population, and to ensure that people are not disadvantaged by them. So I'm now going to just briefly go through what some of the epidemiology and other evidence we have about heat risks. So this may be familiar to some of you. And in fact, I've got some, I think the heat wave there from Chicago from 1995, which is, a lot of studies were done on that heat wave. And it was a clear example of not just of an impact on mortality, but a systems failure within the local kind of public health system. And the hospitals were clearly overwhelmed as well. And also there's some really good, interesting social science done about who was most vulnerable. But if you look at the epidemiological evidence and also some physiological and qualitative research as well that's coming through, then clearly there's an acute effect of temperatures on mortality that's very well established. And when there's a heat wave, you see a peak in mortality. And we also know that hospital admissions increase during hot weather, particularly for people with pre-existing disease, particularly diabetics, and renal admissions increase, but so do respiratory admissions. Impacts on children, we don't have much evidence of impacts on children in the UK. It is different in other countries. So this is primarily in older adults. But there are occupational hazards as well from heat. Again, that's not a huge problem in the UK, but it is a problem in the US. And it's also in Southern Europe. As I've said, we're really concerned about disruptions to public services. So school closures, hospitals not being able to use specific rooms or having to cancel services. So not massive impacts, but still they have a cost and they are disruptive and they will have an impact on people's care. None of the care homes, or very few care homes, have air conditioning in the UK, and there's a lot of research now showing that they're quite. Not only are they not designed so they're overheating, but also the way they offer care doesn't take heat into account. So there's kind of system changes that need to be made as well as physical changes to the building fabric, so to speak. There's emerging evidence around well-being and also sleep disruption and anxiety. There's a link between high temperatures and suicide, and there are some studies showing about link between high temperatures and violence, but I think that the evidence there is not very strong, to be honest. And now there's a lot of epidemiological interest around risks to pregnant women and birth outcomes. So it's quite a well-established link to preterm birth as well from high temperatures, and possibly effects on the risk of hypertension as well. So when we look at the magnitude scoring this is done for each of the risks, then we have quite a lot of information in terms of heat attributable mortality and also heat attributable morbidity. We have less information around how these have been costed, so they haven't been costed as such, and we'd also be interested in these other measures of population health like summaries, QALYs and DALYs, but again, there's no literature on that at the moment that was relevant. But there was a lot of information about which groups are more likely to be at risk. So we did know about the distribution of heat risks. So again, in the UK, because we don't have a lot of air conditioning, there's not really an income gradient on about who's most at risk from heat-related deaths. It's fairly evenly distributed across the population, although London seems more at risk, sort of relatively speaking, than other regions, and we're not entirely sure why. But we're also interested in things like thresholds. So there are kind of thresholds within, people have individual thresholds, obviously, for heat risks, and there are some population-based thresholds as well. But the population-based thresholds for heat mortality are relatively low. They're about 23 in London, so they're well below what would be accepted as kind of as a heat wave. And we've also, of course, assessed the uncertainty around all these outcomes and our confidence in those relationships. So as I've said, we're very interested in the vulnerability factors because we know those will change over time as well. So when you're looking into future impacts, you have to consider for heat demographic change, because as I've said, a lot of this burden is in the older adults, and as populations age, there's clearly going to be a much larger population at risk from heat. And in fact, although we have this reduction in cold-related deaths, which is quite a big benefit, it's largely offset by population aging, so it's not a bigger benefit as people might think it is. And although I said there's not a big social gradient in heat risks, what we found out in 2020 when we had another heat wave, that heat wave was much bigger than previous heat waves. It's nearly double, so it had 2,000 deaths in England from these 3 episodes, and that was because people were in lockdown. So it's highly likely that this shows people were indoors, and vulnerable people were indoors, and also less likely to go and seek healthcare. So there are a lot of things obviously going on in lockdown, but it does show the importance of housing and how our housing in the UK does overheat quite a lot. So in an average summer, it's been estimated that about 20% of housing will overheat, have rooms overheating, so above a particular threshold. So we do think that this COVID and lockdown exacerbated the impacts of this event. So what we did have, as I've said before, we looked at these 2 scenarios of warming, and this clearly shows the difference between the 4 degree, which is the high emissions, versus the 2 degree sort of target. And you can see here, this is the heat health alert for England and Wales, Scotland and Northern Ireland. And you can clearly see here the benefits in terms of temperatures by keeping emissions to 2 degrees. But there's not a lot of modelling, as I'm sure you're aware. There's very little actually quantitative future projections of these climate risks. So it's been done for heat and cold or temperature related mortality. And there's a bit around infectious diseases, but really there's very little of this sort of evidence available, and certainly not at the national or the subnational level. So the other thing to note, so we have the dose response on the left and the kind of classic heat peak on the right. This is back all the way from 2000, which is the heat wave that affected most of Europe and particularly in France. So you can see very clearly there's a very acute effect on mortality, but it's quite short-lived. But if you look on the left and you can see the histogram of the distribution of the temperatures, it shows that if you look at the attributable burden, most of the burden of heat is outside of heat wave days. So if you're, this kind of reinforces the need to have a long-term sort of strategic education plan for heat. You don't just focus all your actions on the very hottest days, because that's not where the majority of these deaths occur. The other thing to consider as well is that, you know, for the more severe the heat waves, the more impacts you're going to get. But also heat does affect other sectors, and it does affect critical infrastructure. So for a very severe heat wave, and this probably happened in Chicago, and we certainly know that it happened in that very extreme event you had on the West Coast recently. You have impacts on infrastructure, you have impacts on farming, and you have impacts on, so you're risking power failures and other failures in infrastructure. And there were obviously issues happening in hospitals and in other places that were just too hot for people to function in. But also we have some private water supplies in the UK, and those failed during the summer. So water had to be brought in, which is the responsibility of the local authority. And we're also quite close in the southeast is quite dry, and consumption sort of tripled due to the summer, which meant that they were quite close to having to restrict household water use as well. So there was quite a lot going on when you have a prolonged heat wave and a prolonged drought. And of course, you can also consider wildfires as well. So people are very concerned about, you know, multiple exposures and cascading risks, and how to plan for these. So in terms of responses for heat waves, there are kind of 2 main responses. As I said, there's dealing with the built environment, so making our housing less prone to overheating and our cities cooler, so we're reducing urban heat islands. There's obviously occupational interventions and occupational health and safety. But we have this heatwave plan for England, which is the public health response. And as I've said, it's not just about warnings on the hottest days. It has to be a broader strategy looking at a whole range of who's at risk and how to educate them in order to change their behaviour. So this is a brief description of the warning. So we have a cascaded warning system. So when the Met Office decides that there's going to be a heat wave on some predefined threshold, they will notify or talk to UKTSA, who run this system, and then alerts will be cascaded through the system. And there's been some evaluation of this, which I'll talk about in a minute, but often the cascades, they start very well at the kind of upper levels, but they don't reach down to the frontline staff so well, which I'm sure is an experience from other types of warning systems as well. But they've also got targeted information sheets. So they've got information for care homes, they've got information for GPs, and they've got information for parents and so on. But we did have an evaluation. So this again was commissioned by the Department of Health. So this is very important. It was an independent evaluation. It's on the Department of Health website. And they did both a process evaluation. So who was acting on warnings, and if they weren't aware of warnings, why weren't they? What were they doing, and why didn't they want to act on warnings? And that sort of thing. And people not understanding what they should do, even if they knew there was a warning, or not understanding who was at risk or who was particularly at risk. You know, just assuming everyone over 60 is a risk is not that useful. And then there was also an outcome evaluation, which is looking at the temperature mortality functions and how they change pre and post the implementation of the heatwave plan. So this started in 2004. So in Europe in 2003, the summer of 2003, nobody had a heatwave warning system. Well, there was one in Portugal and there was sort of one emerging in Italy. There was a devastating heat wave in Italy and France. And then the next year, every country, by 2004 summer, every country in Europe had a heat wave plan, which shows you how responsive public health can be. And we've seen that with the COVID response clearly. You know, you can respond very quickly to these sorts of events and then have functions in place to update them with new evidence as it emerges. And this plan is updated every year with new evidence, and it's just about to be completely revamped in a new kind of more coherent system across several hazards, and it's year round. So they're constantly changing it and improving it. So just 2 more slides on heating. So we explicitly address the adaptation shortfall, which is basically how we're not managing heat risks. So there were obviously some issues with the heatwave plan, but those seems like they can be addressed with better communication and better evidence. But the real gap and the real reason why it's also seen as urgent is the failure in the built environment, particularly the failure to have building standards that address overheating. And yeah, so we're just waiting. The department has got the evidence, they've done several evidence reviews, but there's still been no action. So there's no building standards for new builds, and there's also no incentive for current houses to put in measures. So that's all these costs are now going to be borne by the household. So it's very difficult for them to take on those costs. But there are several things they could do that aren't putting in air conditioning. And then such as putting up shutters, you know, and putting in, if you can, putting in more shade. So if you, there's clearly a concern to put in a load of air conditioning because it uses electricity, but the UK is trying to switch to wholesale renewable electricity. So if your electricity is 100% renewable, then that's not actually going to cause an increase in emissions if you start using that electricity to run your air conditioning, if so to speak. But there may be other issues around using air conditioning, like, you know, using too much, not getting acclimatized and that sort of thing. So there's clear more action needed in the building sector, but one of the key issues here, of course, is mitigation. And there's a lot of carbon reduction has to be done in the household, and particularly around insulation. So there are a lot of pressure for people to insulate their houses and reduce ventilation. So there's a real risk that if a lot of people change their houses to reduce their carbon emissions, they will increase the risk of overheating because they'll have sealed up their houses, and not just risk overheating, but clearly increase the risk of having poor air quality. So, which would be, you know, not good. So there's a lot of there's a real concern in the UK at the moment that the net zero is going to make some of the heat risks worse. And clearly this is an avoidable problem, but it's actually a very technical problem. And there are solutions, and the Committee on Climate Change is working really hard to try and communicate those solutions. Okay, so I'm going to talk about flooding now, just more briefly. So clearly we have several types of flooding, and there's a lot of good modelling that quantifies this future flood risk. And you can see this from the map, which actually shows changes in number of people at risk of flooding. So some clear risks around the kind of northeast, which is coastal flooding, and also London and the southeast. So we have risks from coastal flooding, which is exacerbated by sea level rise, river flooding and surface water flooding as well. So not that many people, fortunately, are dying. So direct, in terms of numbers of deaths, it's very, very small in terms of flooding, but it's the social costs of flooding that we're really concerned about. And I'm going to show some results from a EPI study on mental health that was done with Public Health England a few years ago. And there are also kind of a lot of more equity concerns about flooding, about who's affected or who's flooded, and who, once you're flooded, then who's got insurance, so who can respond better or who can adjust better to those impacts of flooding. So there isn't a lot of evidence around the morbidity impacts of flooding. Okay, there's not that good evidence actually around the mortality impacts, because there's not a way of routinely reporting them. In fact, you might get, for an individual flood, there will be a case report, but there's no set, you can't just pick out the number of people who've died from flooding if you look at death registration data, for example. So it really depends how they're flooded. There's also accidental or injury data, but even that's not that comprehensive. So I could say we actually don't have a good idea of the total burden of flooding. And we certainly don't have an idea of the total health burden or the total social burden of flooding. And a lot of the flooding, a lot of the burden of flooding estimates are linked to property damage. And we know that the health impacts are not going to be proportional to the property damage at all. So that might lead to not making the right decisions in terms of flood defences, which are all done on a cost-benefit basis. So in order to address this research gap, and there was a lot of pressure, well, it wasn't until basically no one would fund this research, which is strange, you'd think, but it's not seen as a novel mechanism, because people thought that everybody knew that flooding clearly causes mental health problems and long-term depression, but it couldn't actually be demonstrated. So in the end, Public Health England, which is now the UKHSA, just said they were going to do it themselves. So they funded this study and conducted it. And it was very well done. So they surveyed once after 12 months and then again up to 3 years, the same population that were flooded in winter 2013, 2014. And surprisingly, so this is self-reported outcomes on mental health. So again, we couldn't use routine data for this because it's just not technically feasible without a lot of extra money. But they looked at, standard tools for depression, anxiety, and PTSD. And as you can see, the prevalence post-flood compared to pre-flood, not compared to pre-flood, compared to non-flooded people, it was very high, surprisingly high. And that this has been sustained. It's obviously reduced, but there's still persistent depression in the flooded people after 3 years. The other thing to note is that the people who are disrupted, so not flooded in their houses, are also reporting higher rates of depression as well. So that again has implications for where you might want to have your response. So one of the key things around flooding is that we know that a lot of people are displaced and a lot of displaced for a long time. So we had another project where we're looking at the impacts of displacement. So people who are displaced compared to people who are flooded but not displaced had worse outcomes, but those weren't related to the duration of being displaced, but they were related to not having a warning, which is what you might expect. So it doesn't matter how long you're out of your house, but it does depend on other things like insurance. So not having insurance made outcomes worse, which I think is quite important. So just 2 final slides around health system disruption. So we're very, there's a surprising lack of evidence about the impact of extreme weather on health system delivery. There's the odd report, but we've got no comprehensive assessment of the population-wide impact, especially in terms of financial cost of these extreme events, and particularly heat waves, which are not routinely reported. So not using a room because it's too hot, or not using a room because it's flooded, or having to cancel surgeries because you've got flooding, or having your scanner flooded because it's sitting in the basement. We don't have any kind of idea of the magnitude of this problem, but we know it is quite a significant problem. And this shows assets. Again, this is flooding. This is current flood risk for various healthcare assets. And you can see that there's quite a big risk from surface water flooding. So one of the main risks in the UK, from the last assessment to this assessment, is there's a much more climatological information about the importance of extreme weather, or the intensity of these rainfall events. So they're very damaging and very disruptive. They're not necessarily more lethal. So they wouldn't necessarily not associated with people drowning, which we're really concerned about a catastrophic coastal flood. That is what would give you a lot of people who might die. But the surface water flooding is hugely disruptive and therefore costly to health system delivery. And there's a lot of examples of that. And this is a qualitative study we did for actually a coastal flood that was up in Boston in the Northeast. And again, because there was such a lack of evidence, we had to do interviews with frontline staff to see how they handled the flood, how aware they were and what state of planning there was. So in fact, there was awareness about flood risks and awareness about flood warning, but there were so many issues, sort of little issues about planning that didn't work. And in fact, this was kind of a near miss because it wasn't a major flood. It was a minor flood, but still they were evacuating people from care homes and from bits of the hospital. And there was no coordination and all those sorts of things happened. So it's actually very enlightening and was fed back into the emergency planning and hopefully has led to some improvements in policy. So as I've said, we're very concerned about, and there's a lack of evidence around risks to health and social care delivery. So care homes, hospitals, clinics, both from heat and flooding and other types of effect. So I just have some few final sort of summaries now around adaptation assessment. So this is the sort of evidence that we want more of in order to do adaptation assessment, which is an important part going forward. And we already have to think about, do the research now for the next climate change risk assessment, which will be started in about 3 years and then published in 5 years. So, it takes a while to get research. So it may already be too late in terms of funding to get this research completed. But clearly more quantification around the impacts of individual events and then more assessments of, and I think funders have understood this. Wellcome's just issued a call around evaluating heat interventions. So there's a lot of interest now, and hopefully there'll be enough studies online to inform the future risk assessment. But there was some, I said there was limited information of cost effectiveness, but it has been reviewed in this report by Paul Watkis. So you can see clearly what is more cost effective, and things like early warning are very cost effective, mostly because they're quite cheap to do. And it depends to what extent you add in all the response measures that are attached to a warning. But you can see that flood protection and household flood protection are also highly cost effective. But that doesn't mean that there aren't incentives. There's a lack of incentives on the households and on individuals to undertake these sorts of measures. And it might be more efficient for government to invest in some of these strategies. So this is the Climate Change Committee's strategy for developing an adaptation policy, which covers a lot of things that I've already said, particularly around lock-in and assessing inequalities. There's clearly a lot of work to be done there. I think there's probably a lack of information about the inequalities of particular adaptation strategies. And of course, addressing inequalities is not easy. Even though it's a government priority, there are going to be real difficulties in getting some of these measures through. And it entirely depends on other investments and other decisions taken elsewhere in the system. The other thing to note is, of course, there will be limits to adaptation. And one of the things we did in the previous report as well is trying to understand where the limits were. And there are obviously technical limits, there are financial limits. But there's a real limit around changing people's behavior. So there are, in terms of managing water security, so water use, in terms of managing heat risks, despite increased awareness, there's been a lack of changes in behavior. And we know this from several surveys. And even with flooding, there's been a lack of uptake of these household protection measures. So people's behavior are not changing as perhaps people might have assumed, or perhaps people have put in their models. So that of itself is going to be a barrier to adaptation, as well as these more obvious barriers by kind of, less of the government not putting in building standards that address overheating. And then this lack of coordination with net zero is clearly going to be a problem. And there were, the report's got a really nice table at the end where we address where all these synergies and conflicts might be. So just to conclude, you know, there's clearly a lot public health could do anyway. So generally strengthening public health will clearly be a benefit beyond and above these specific adaptation measures, and particularly improvements in surveillance. So to improve our information so we can quantify these risks is clearly also an important part, but also raising awareness. So making sure that people understand that climate change or adaptation is part of their remit will help. And I'll stop there. Thank you.
Thank you, Sari. That was really great. And it's very impressive how all your work, but the comprehensive approach also in the UK. So I'll be calling for questions and comments. I see one or two in the chat, so I'll pick up on those in a moment. But I wonder if I could start us out with at least, you know, from the context of Chicago, and also I think more the American context. I think we see a lot of the more extreme potential situations like the heat wave here as being mediated by very local environments, often at the neighborhood scale, where we know that there are pretty extreme disparities within the city and within cities. And so, and these are communities that often, you know, as we've seen also under COVID, are maybe less responsive for a variety of understandable reasons to you know, top-down sort of announcements, as well as they may have limited chance of adaptation in terms of changing housing, partly because they're renters or lower-income households. And so how you told us a lot about the general picture also in the UK, but how does one address you know, situations that have much higher risk, but also in communities that, because perhaps aging households are less connected to technology, or because disadvantaged households have less capacity for adapting and trusting the government? How do we handle those situations in ways that you know, improve the system as a whole, as well as help us adapt?
Yeah, no, I think that's so important, but it's so difficult. You know, it's always been difficult, and it will be difficult for adaptation. I mean, I guess one hope is that if governments are serious about adaptation, they will invest in it, and making a good case that these groups are particularly vulnerable, and demonstrating that through good evidence, you know, maybe lever some extra investment in those areas. But I think it's really hard because it just, you know, there's a risk you'll end up with increasing divisions, because you can clearly see that some groups will take up adaptation measures and other groups will be left behind, and that will increase the inequality. So I think that's probably where we are in the moment, both in the UK and the US. So I think it's important. I don't have a straightforward answer, except, you know, to communicate with other sectors. And we have another strategy about, it's called Leveling Up at the moment, but it's essentially about addressing inequalities. So making sure that you can communicate with those policymakers so they understand the climate issues as well as possible.
Do you work with local organizations, civic organizations that may help sort of from the bottom up motivate some of these responses? Is that part of the strategy?
What we're doing now, as I said, that the CCRA was about national governments. We just got a small grant from the NIHR, the Department of Health, to look at. They're very interested about local action, because a lot of the actual responses are done at the local level. So things like planning, things like building regs, that's all part of planning codes, and even managing green space, that's all local. So, and public health is a local responsibility. So in fact, you know, that's where the attention should be, supporting local actions and local government. So we're engaging with a lot of local government, and we will engage through civil societies through that as well. Yeah, certainly to it's the best way to address some of these vulnerable groups.
Thank you. That remains sort of a challenge, but so important. So please share your questions. I'm gonna call on one by Kovats van Rooyen. Do you want to jump in, Kovats, or do you want me to ask you a question? So I'll give you a couple of seconds. If you can jump in, please do.
Yeah, can do. Thank you very much for your presentation. I'm actually based at Birkbeck today, so I'm right next door to your
oh yeah.
to your Just a quick question that I wrote down. So I know that the CCRA is quite extensive report. So obviously, I assume that the Met Office plays a role in providing research and information. But do you follow another strategy as well to actually reach out to different organizations or the most relevant organizations to provide you with research and information?
So with the CCRA process is quite comprehensive, I would say. So there was a call for evidence. They issued 2 calls for evidence. So that's to the extent that groups are engaged with those with calls for evidence, then we would have picked them up. But it's actually quite constrained within government. So there weren't many non-governmental organizations involved in this discussion, if you see what I mean, except sort of representatives of the water companies or representatives of those sort of networking bodies were there.
Yeah.
I'm trying to think of a civil society type organization, but they weren't there. So I think that's an issue about whether they should have been in that stakeholder room as well. Mm-hmm. But clearly when the research is shifting towards kind of local type impacts, they're much more likely to be involved, because it's nothing will get done unless there's community engagement. That's clear.
Absolutely. Thank you.
Thank you, Sari. Thank you, Kovats. Trevor, do you want to jump in with your question? Trevor Price is one of co-conspirators.
I just had a couple of questions about uncertainty. First of all, when you communicate risk, how do you do it? Do you give the upper limit, sort of 95% upper limit, or the median? And is that appreciated by policymakers? And in your presentation today, when you present things like number of people at risk from flooding, would that be the median or the upper limit? And the second part of this question is, it seems like we really don't know what would happen with 4 degrees. There's so many unknowns. Are we really doing better just guessing what might happen?
Okay, well, there's several things in that question. The first one is it is interesting how the Met Office and the climate people who produce climate scenarios work. Okay, because they do go for the means. So we went for the mean estimates around 2 degrees, the mean estimates of 4 degrees. So you don't take the upper limits of everything, but arguably we should have for some of these things, because decision makers maybe want to know what's the worst thing that could happen. But climate scenarios are fairly constrained anyway in the way that they're produced, so they're not necessarily going to tell you the worst things going to happen. They're averages anyway, and there's so they did want us to consider low probability, high impact events, but it's very extreme events people can't plan for anyway to some extent, because they're so outside. So I think going forward for the next CCRA, that you're absolutely right, there needs to be better work done to communicate some of these maybe more worst case scenarios or the range. But it also kind of assumes we had a lot of quantitative evidence that then we could do a distribution to. But in the health sphere, as I said, we don't have that. So it's highly qualitative. So it's more around sort of more traditional health impact assessment. How confident are we that high temperatures cause preterm birth, for example, and that sort of quality of assessment. And then we did a lot of focus about how the drivers might change. So what will increase vulnerability, So in a world that's more unequal and there's a lot of more older people in it, then clearly the impacts will be greater versus other types of scenarios. But it's a good question. There's always communicating uncertainty is important, but policymakers don't necessarily want to know all that level of detail either, do they?
Thank you, Sari. Yeah, we see that in the IPCC report, right? As you've been part of the effort too. We're talking about beyond adaptation in some cases and so forth. So of course transformations may be so large in some cases there, but of course there's a path to getting there, hopefully, and we won't get there. So Mercedes, do you want to jump in and ask your question? Mercedes Pascual is also.
Yes, thank you, Sari. That was very interesting. So I had a question in your first thing with a lot of boxes. You had certain categories that had to do with other species, fisheries, marine environment, so other sectors. And you also had in your big circle, you had health, and then you had biodiversity. So I was wondering whether you can comment on how you are working with other sectors concerning these issues.
I think that's a good question. So I think the main mechanism is we took an ecosystem services framework. Okay, so we're trying to quantify or consider impacts through changes in the ecosystem delivery. So we looked at food production because that's part of the natural environment, but we're obviously siloed. So a lot of the issues around natural species, indigenous species and exotic species and food production in the UK was all in chapter 3. So we considered it in relation to infectious diseases and the management of infectious diseases. And we considered it in terms of food production, which of course is also from outside the UK. And then we considered it all in relation to nature-based solutions. So there have been proposed nature-based solutions, mostly around urban green space for cooling. So clearly it does function as cooling, but not, you know, with some caveats, depending where you are. There's probably more evidence about nature-based solutions being effective for flood control. But we just frankly didn't have the detail to go then into which nature-based solutions would then promote biodiversity, etc. And there's also, it was also posited as that trees, you know, reduce outdoor air pollution. But again, there's a lot of caveats around that. So to be honest, we focused on the evidence around the efficiency in terms of the hazard, and all the issue about co-benefits is in the other chapter. So I'm not up to speed on it. Does that answer your question? Because,
no,
you know, partly because, you know, I'd be interested to know how important that is to the decision makers that we're targeting. You know, if they were truly considering all these co-benefits, particularly biodiversity ones, then we should certainly be producing that information for them. Do you see what I mean? So we do need to do it better, I think, but we probably need, you know, a more kind of standardized approach, or a very kind of well understood method for communicating and quantifying these co-benefits.
Yeah, no, you raised the important question of how important is the perception for policymakers. But as with all the things, there is a question of information to them about why it is important. And maybe because this is silo, when we think about public health, it may not be understood enough at the level of policy. So I think it's an interesting, not the unique one, but one, an important angle.
Yeah, and there are the co-benefits as well, you know, so we could also be criticized for focusing too much on the kind of biodiversity benefits versus other co-benefits of particular strategies. I think there's a big pressure to look at nature-based solutions as well now.
Great, so I think we're almost on time, so I'm just going to take the last few minutes to thank Sari again for a very interesting talk and very impressive sort of work, of course, and very systemic approach where that's revealing many of these, sometimes to me anyway, unexpected connections, for example, to mental health, and trying to elucidate a lot of the intervening issues of natural events and so on. And so on that topic too, of the last question Mercedes was asking, our series was focused on two main themes about biological science and climate change. We've had 2 talks now on public health, and the next talk will be in 2 weeks from now on a focus more on biodiversity by Claire Kremen from UBC. So I hope to see you there too. But I want to really thank Sari again for really being with us at the beginning of our weekend in the UK. We really appreciate that. And we owe you a nice tour of Chicago and a nice dinner whenever you can come and visit us. So I hope that we can make that happen in the future sometime. So
No, thank you. It's been a pleasure.
Thank you, everybody. So I hope to, so I think we put a link on the chat if you want to register for future talks. And we look forward to seeing you again. Thank you again, Sari. It's been a pleasure. It's been very inspiring to learn more about your work and what the UK is doing. Thank you, everybody.
Thank you. Bye.